Wonderful. Hi, everyone. Welcome. Welcome to Salud y Querencia. And this is a community conversation we will be having brought to you by the Health Equity Council located in Bernalillo County. My name is Diana Lopez, and I am sitting in for Dr. Carmela Roybal. But I'm very happy and excited to be here. And again, this is Salud y Querencia, which salud means health. And I wanted to talk a little bit more about the word querencia. It fits perfectly with what we're trying to do here today and have our conversation. I read some definitions in regard to it, meaning a place where one feels at home or a place where someone feels drawn to. I also was reading an excerpt from the book Querencia from an author who is a professor at UNM, and his name is Spencer Herrera. And his definition of the word querencia really comes from a place of, I felt with deep meaning from New Mexico. And I just wanted to share that all with you today. And he says the basic definition for the Spanish language word querencia is a metaphysical concept taken from the verb querer, which means to want or to love. But the reality of querencia is more complicated, more poetic and sentimental, seated in deep emotions and culture and a sense of longing for the belonging to a place where the heart resides. And I just felt like that was so beautiful and really speaks to this gathering here today, where we talk about health topics in the community, whether it's harm reduction, COVID, anything that you can think of, health topics that pertain to us, to you, to community. So it's really an opportunity for us to discuss things. If we have questions, bring up those questions as well. The Health Equity Council is a nonprofit based in Bernalillo County, and their vision is a community that supports the ability of everyone to meet their full potential, a community that provides the support needed to every community member. So tonight, I want to jump right into our special guest speaker. We have Dr. Miranda Durham here from the New Mexico Department of Health. And we are so excited to have her here. And we will be, she'll be sharing some information about COVID long haulers. So I'll let her go into that definition a little bit more. But again, we're really excited to have you, Dr. Durham, and I will hand it right over to you.
Great. Well, thank you so much for having me tonight. It's nice to be here. And I did prepare a few slides to share on the topic of long COVID. I think your introduction was so perfect because, I think central to that is sort of safe and happy home is good health. And I think, COVID has been such a stressor in so many ways, and threatened health in so many ways. And then, sort of starting to realize the impact of post-COVID. It's just one more facet of this virus that we've been dealing with, and another way that it's impacting people's lives. So this is kind of a broad overview of post-COVID conditions. Just to start with, our Department of Health mission is to ensure health equity. We work with our partners to promote health and well-being and improve health outcomes for all of New Mexico, and definitely all the work that you guys do out there and the health councils, definitely part of that partnership, as Diana and I were out running around putting swabs in people's noses a year ago. So Anyway, okay, so to start with post-COVID conditions, I think the very beginning of this is just like, what are all these different names? And they really are different names for the same, well, for an entity which is also hard to wrap your arms around. But people call it post-COVID conditions is kind of the CDC umbrella term. So if you're Googling and want, CDC information, you're going to find it under post-COVID conditions. That's also what's used by the World Health Organization. But we know it gets called, post-COVID syndrome, post-acute COVID-19, long COVID, chronic COVID, long haul COVID. People call themselves long haulers. And then a new term that's kind of popping up in the scientific literature is post-acute sequelae of SARS-CoV-2. And so you'll see it as PASC, and that's the National Institutes of Health, or the NIH is the term that they have been using. So right from the get-go, we can see there are a lot of names. This isn't just kind of a simple thing to figure out. And one of the problems that I think we've had in talking about it or studying it or understanding it is really like, really understanding what it is. What's the case definition? If you're comparing one study to another study, right now, there isn't kind of a set definition of post-COVID syndrome or post-COVID conditions. So the World Health Organization convened people from all across the world and from lots of different walks of life. So scientists, virologists, clinicians, and patients, and got them together and went through this iterative process where they kind of sat and said, what are the most important things to be in the definition? And people kind of voted how important, and then that kind of got narrowed down and they went through it again. And so this longish definition that is on the screen here is what they came up with. And right at the beginning of the World Health Organization information, they say, we really expect this probably is going to change as we learn more. One of the differences in the World Health Organization is they really looked out like 3 months from the onset of COVID-19 symptoms. And in the US, you see more just a month out or 4 weeks out. And so I guess I can go ahead and read it for people who can't see the screen, but post-COVID-19 condition occurs in individuals with a history of probable or confirmed SARS-CoV-2 infection. So usually 3 months from the onset of COVID-19 with symptoms that last for at least 2 months and cannot be explained by an alternative diagnosis. Common symptoms include fatigue, shortness of breath, cognitive dysfunction, that's the brain fog, but also others, and generally have an impact on everyday functioning. Symptoms may be new onset following initial recovery from an acute COVID-19 episode or persist from the initial illness. Symptoms may also fluctuate or relapse over time. So one of the things that sort of stands out about this is that you do not have to necessarily have a documented COVID case, because we know that there are places in the world and places in the US where people had a hard time getting testing during some of the peak, some of the surges. There's people who probably had COVID before we knew COVID was in the United States. One of the other things that has been done to kind of standardize this is that the World Health Organization did come up with an ICD-10 code, and those are the codes that doctors and practitioners, healthcare professionals use in your medical chart. So, diabetes has an ICD-10 code. Common cold has an ICD-10 code, and now post-COVID conditions have an ICD-10 code as well. And that's, I think a nod to, this is a real thing. It also allows doctors to kind of track it over time, or clinicians. And it also does help create a little bit of standardization. So there have been some interesting studies that have been done with people reviewing records on anyone who has this code in their chart. So, as kind of a long, this is kind of how CDC describes long COVID, but long COVID can be considered a lack of returning to your usual state of health after you've had COVID-19 illness. And post-COVID condition might, it's interesting because it's most likely not just one thing. There's sort of different buckets that people have, or that you can maybe put people into. So there's people who have had really serious hospitalizations and ICU stays, and there's kind of a whole host of things that we know happen to people who've been in the ICU, like they lose muscle mass, and all the medications they've been on often do cause kind of a brain fog of its own. Then there's people who kind of develop new medical problems after having COVID. And, we know the rate of diabetes diagnoses goes up after having COVID illness, or sometimes people develop lung issues, scarring, or some asthma. And then there's kind of this whole other group of things that come that are like the autonomic things, the people who like stand up and suddenly have really rapid heart rate or dizziness, and their bodies just feel like they aren't working and aren't working as well as they used to. People who suddenly are so fatigued after exercise that they can't do anything for the rest of the day. So the most common symptoms is cough or feeling short of breath, a loss of smell or change in taste, fever, body aches, headaches, chest pain, stomach pain, the brain fog you hear people talk about a lot, having trouble sleeping, feeling very tired, and mood changes. So that was kind of the start. And then here's more that are listed on the CDC website. I think a big one is this post-exertional malaise, which is what I was talking about, people who just do even minor physical or mental work and then just feel worse for the next 12 to 48 hours. I think in our culture in America, there's a lot of like, just get up and go, don't let it get you down. Well, for people a lot, and again, nothing is everyone with post-COVID syndrome, but for a lot of people with post-COVID syndrome, that really isn't the right advice. Rest really is. And again, this post-exertional malaise, you see it in some other conditions like chronic fatigue syndrome for some people. In some of the studies that are being done, we're up to about 200 different symptoms that people have attached to post-COVID syndrome. So the list is long. One question that comes up is just, how long does it last? And I think that's one of the hardest things for people who have post-COVID syndrome. Like, if you can see a light at the end of the tunnel, then, it's much easier to kind of work your way through and do what you need to do and just know that it's going to end. But it's hard to know. I thought this was an interesting study done in the United Kingdom. And I think what is maybe hopeful for a lot of people about this is that, so here's weeks on the bottom here. This is starting at 5 weeks. You still see a large percentage of people who've had COVID that still have symptoms. There is, and 5 weeks is a really long time to be feeling sick. But in the scope of long COVID, I think what we do see here is that a number of people who continue to have symptoms does drop off. So at 12 weeks, a lot of people really are getting back to normal. And so that's good news. They'd still be considered having had long COVID, but really returning to normal. And then we have this other group of people that continue to have symptoms, which again, it's a small percent, a large number of people, just because such a huge number of people have had COVID. So risk factors for long COVID, again, these aren't completely clear. There was a study out of the VA that started to show some of those. One was, and again, we don't test the level of COVID RNA in the blood when you have an infection, but when they went back to the study, they said, okay, the more COVID you had in your blood early in the infection is a risk factor for post-COVID syndrome. Another was the presence of autoantibodies. Sorry, my screen's going nuts here. And these are antibodies that kind of, we all know now antibodies help attack disease, But autoantibodies actually sort of attack your own tissues. So that's what's at play in things like rheumatoid arthritis and lupus. So that the viruses seem to spark autoantibodies. And then a third factor, and again, these are kind of theories and have come out of some early studies, but Epstein-Barr virus that a lot of us have been exposed to, that there's some thought that that reactivates in long COVID. And then the fourth factor was having type 2 diabetes, that might be a risk factor for long COVID. Again, lots and lots of people do have diabetes. So sometimes it's hard to tease out, is it really a risk factor or there are just a lot of people with diabetes? So how common are post-COVID conditions? And this is, again, so many different numbers get thrown around depending on what you're looking at. But, I think this is kind of a stunning number at the bottom of the number of people who were hospitalized. More than 30% at 6 months were still having symptoms. For some other ways of looking at it is 13% at 1 month or longer after infection. And that's kind of taking all people with infection. So people who had no, asymptomatic to hospitalized. It's, again, a large number of people. And CDC recently put together a paper looking at post-COVID conditions, and their conclusion in the end was 1 in 5 adults ages 18 and over have a health condition that might be related to their previous COVID illness. So again, a wide range. Not all of these people necessarily have kind of the fatigue and brain fog. Some of them might not have gotten their sense of smell or taste back. Some of them might be struggling with shortness of breath, some with muscle weakness from having been in the ICU. Diagnosing post-COVID conditions, I think this is sort of repetitive, that there's really no test to diagnose post-COVID conditions. There's a wide variety of symptoms, and some of these symptoms can come from other health problems. So I think that makes it challenging, like when you go to see a provider. Sometimes it feels like you're getting a lot of tests and it's really showing nothing, but providers will listen to, like, oh, I'm short of breath, my ankles are swelling, and think like, well, this could be, could it be heart failure? Could it be asthma? Could there something wrong with the kidney? So you want to kind of check all those things and make sure it's not something else at play that could be treated. So it's difficult to distinguish the symptoms caused by post-COVID conditions from symptoms that occur for other reasons. And I think a big question that's come up recently is, how protective are vaccines? So there have been studies that say, if you've been vaccinated, you have a much lower chance of getting post-COVID syndrome. There are other ones that are kind of more like, we're not so sure about that. The United Kingdom did put together, look at 8 studies. 6 of them found that vaccinated people were less likely to get long COVID, and 2 studies found that they weren't so sure about that. So there are lots of theories about what actually causes long COVID. So persistent virus, is it still kind of hanging out in your body, even though you're not infectious? Is it the viral remnants that are triggering chronic inflammation? Is it this autoimmunity? Is it dysregulated gut microbiome? We all have all these bacteria in our gut, and there's a lot of attention now, like if that gets out of balance, what happened, how much it affects the rest of our health. Latent reactivation of the viruses. So many of us have been exposed to Epstein-Barr. It's one of those viruses that just kind of hangs out in our body and usually doesn't cause a problem, but is it possible that COVID's reactivating it? And that's part of what's causing long COVID. And then microclots. We know that COVID does cause clotting disorders for a lot of people. And that's one of the theories of what's causing long COVID. Children also can be affected. They've overall had fewer COVID infections, but they definitely can, children and adolescents can get long COVID. And so then taking us to prevention, there's no magic bullet in this disease of COVID. So I think we've just said over and over again, like, vaccines may not be 100% at protecting you from COVID or post-COVID syndrome, but they are the best tool we've got. And just not getting COVID in the first place is going to be the best defense against long COVID. So masking and social distancing, using those old tools that we started with. Just a quick message about research in the US. There is a huge NIH study, and the University of New Mexico does have an arm of that study. So for people who are potentially interested, they do look like they're still enrolling participants. And so that is what this is about. There's also some great online resources. The CDC lists these for their support groups. Some of them are actually like you can get online and join a community and talk about your situation. And some are more like they have a lot of online resources and do a lot of advocacy, but they're really incredible networks. One of the Survivor Corps keeps track of states and who has post-COVID clinics that are really providing that kind of comprehensive and caring care for people who have post-COVID. New Mexico does have a few of those, they call them PCCCs. The Loveless Health System has a few, and then I don't know why the others dropped off, but there's Lubbock, Texas, and there's one in Las Cruces. But if you go to this map and click on New Mexico, they'll come up, and they keep adding as more clinics come up. The other thing to remind people that long COVID did qualify as a disability under the Americans with Disabilities Act, and that was in July of 2021. So there are, this is just some examples of what some of the accommodations that employers or schools or families might make for their loved ones with post-COVID. And then the CDC has some resources, like this is a healthcare appointment checklist for post-COVID conditions. It may or may not be helpful to go through like before you have a visit with someone if you're suffering from long COVID or think you are, and just kind of look at some of these suggestions, because it really can make people feel overwhelmed, kind of all the things that don't feel right about their bodies. And that is all I've got for slides tonight. Thank you for all that you do out there to help share information. And I'm going to stop sharing. All right.
Hello, this is Matt, another health promotion specialist with DOH. Thanks for a great presentation. I'm curious there's lots of variables with timing and symptoms and things. Is it for someone who has recovered or they think they've recovered from COVID, is it simply a waiting game to see how your body reacts over time? Or is there anything to do in the meantime?
Yeah, I think that is a really good question, because part of that definition is that symptoms can wax and wane. So I think people do experience that, like, whoa, today was better, and then boom, that and that's a really tough cycle to live. That kind of disappointment of not having just a clear trajectory towards better. So yeah, I don't think there's sort of a set definition of when you're really out of the woods. It kind of seems like from talking to people that, people do, that starting to feel better isn't a like wake up one night and feel better. So it's, I would say it's kind of like an undulating, but overall, headed towards better kind of pattern. But I mean, there are some people who the good news is for a lot of people, we see that 12-week mark, they're getting better, and each week that goes by, more people are getting better. But there are some people where it's now been a year or more. So it's a tough to know. One thing that has come up that I wanted to mention is, I think there's been some questions about Paxlovid, the antiviral medication that's recommended within the first 5 days of illness. And, is this a treatment? Should people be on it longer? with long COVID. And so I did come across a study that just studied 3 people that happened. So it's not authorized for that use. So really clinicians should not be prescribing it at any time except for in that acute COVID.
Dr. Durham, hi, how are you? I'm Chris Hollis, and I'm another one of the health equity specialists around. I was just curious because I know you and Dr. Perahone both, are out in the community a lot and doing a lot of these talks with people. I'm kind of wondering, overall, as you do that, what are sort of some of the major concerns that people seem to have? In other words, like, questions that you continue to get from a lot of people. And is this issue of long-term COVID coming up a lot more or not?
So I think it's probably more comments from people with long COVID is that feeling, I think this comes up every time there's something new. The medical profession doesn't really know about it or understand it well, and there's no good treatment for it. And so that feeling of just being not validated, feeling like, I'm suffering with this thing and no one believes me. And again, I think our American culture in general is kind of get up and go, just grab it by the horns. And, and that just isn't what works for this. So that, and then I think just the usual questions of, what treatments might work. There are things that look, reasonable to try on, some people have said just a common antihistamine has helped with some of the feelings of dizziness. That, that seems like a relatively safe, take an allergy pill, and people sort of discovered this because they also had allergies, took an allergy pill and felt, and it's unlikely to work for everyone, but if it helps some people, great. Then there's some kind of further, like a little more intensive experimental treatments that are very costly, and those ones I would really say, none of them have really looked like they've been studied enough to be, worth the risk and the cost until a little more is known. So I think that's mostly what we're hearing from people. I think people are interested in the Paxlovid question. I think we all are, and hopefully there'll be more information about that. And I think those are probably the biggest ones. And whether vaccine, I think that's another one. If you have long COVID already and haven't been vaccinated, is getting vaccinated helpful? And again, it really mixed results on that. So there was a study that showed, I think it was about 40% of people really did feel better. There was a big chunk that there was no change, and a couple, 10% that felt worse. So it is kind of maddening, as everything in COVID is, that, it's just hard to get an answer. And I think this probably is because long COVID is a little bit, it's probably different factors affecting different people, and that's why different things are working for different people.
And how about, because I know you've been out again talking about COVID still, are there any particular concerns that people are still bringing up that you hear quite a bit? In other words, like for people like the health promotion specialists and others out there, community health workers, what are some of the areas that you keep hearing that we know we have to keep addressing?
I think right now it's probably more about coverage and resources rather than specific, does this test work better than that test, or which vaccine? So I'll say that. And then also just that, what is coming down the pike is vaccines for the youngest kids. So I think there's more questions about that. So we'll know more about that by the end of the week. But I think today VRBPAC did, the FDA subcommittee did okay I think it actually, I've been in the car driving, so not exactly sure, but one of the youngest kid vaccines, I think it was Moderna, and they did approve Moderna for kids 6 to 17 yesterday. So still has to chug through some of the other approval processes before we're giving it, but there's a lot going on with vaccine. But the other piece is just the coverage, because I think many people have heard, you know, the way a lot of the free testing and vaccine in New Mexico and everywhere across the US was funded is through federal FEMA funds, and that is likely to end June 30th. So again, and you know, we can roll through that if you want some, you know, kind of what resources are out there for people. But I think the good news is that there still are places to get free testing and vaccine, and insurance covers it if you have insurance. And Medicaid is actually great in this state at covering all kind, I mean, testing that private insurance doesn't cover. So really a good resource.
That's some really great information, Dr. Durham. And I had a question as you were speaking. If someone tests positive for COVID and they are completely asymptomatic, never developed symptoms, and I apologize if I missed it in your presentation, are they still at risk for developing long COVID symptoms?
I think overall there's a pretty, well, I would say it looks like we're getting more clarity on the worse the COVID you had, the greater the risk for long COVID. But it's not zero even for an asymptomatic person. So if you take all the people who didn't have symptoms, and I don't know what the percent is off the top of my head, but a relatively low percentage of them will get long COVID. And if you take all the people who had ICU stays, that number is the one that's about 30% of hospitalized patients could have long COVID. And it's just kind of a continuum between those two.
And another question I had is just something that I've heard from some folks in regard to taste and smell. I personally know a couple that had COVID months ago, and they're still kind of not, they really don't have their full taste or smell back. Have you heard anything around that? Or I've also heard of some people not having their taste and smell, and then them talking about, I'm having to retrain my brain, and, you know, smelling something or tasting something and literally saying out loud, I'm drinking coffee, you know, just, I don't know if there's any data behind that, but have you heard anything around that?
So I guess not exactly data, but just to say, I mean, that also seems to be a continuum where, you know, the majority of people, it's at 2 weeks that their taste and smell come back, but it definitely, you hear people that are out months and it hasn't come back. One thing that's interesting is that I think at the beginning, when that symptom was first coming to light, people really talked about it like it's damaging the nerves that are involved in taste and smell. And it looks like that probably isn't so much the case, that it is more kind of the lining cells that are damaged, and they do regenerate. So it does seem like, and a lot of times nerves regenerate too, but very slowly. But you know, it does seem like one of those ones that should come back over time.
As you were mentioning data, I was wondering, is DOH collecting the data? Is there any, I guess, partnership with the studies at UNM? Is there any kind of long-term collection being done through the state of New Mexico?
Yeah, that is a great question. And I was curious about that. So haven't done exhaustive research into the question, but I did ask some people at our Epi and Response Division, who are the ones collecting all the testing data, and they said no, that because that kind of data collection is very different than kind of the acute disease model collection. So yeah, it does seem, I mean, I think it's an interesting question about how that could get done. And a lot of the studies are getting done. With the UNM studies, kind of a, you know, looking forward study, but some of the studies kind of looking back to try and figure out, you know, how many people had which symptoms are ones where there's kind of searching the VA database or the an EHR database. And obviously DOH doesn't have that kind of, doesn't have access to those kinds of databases. But when you see that list of, you know, 200 symptoms, I mean, I kind of thought, could I even come up with 200 symptoms if I sat down to write a list? I mean, not just about COVID, but anything. I mean, it, you know, I think it really does speak to the fact that, yeah, there are some probably, this virus does cause kind of not the usual. Flu seems pretty standard. You kind of know what you're going to get if you get flu, but this one seems really unpredictable.
Dr. Durham, I was kind of curious, and I know it may not be in your area, but there has been a lot of conversation too about the fact that, you know, the whole healthcare system has suffered so much, you know, with just dealing with the COVID piece of it. And of course, the cases are going up now even more again.
Yes.
But I'm curious, how is DOH thinking about, you know, the concerns that a lot of people were bringing up of how this is going to hit the hospitals and the healthcare system around dealing with the long-term COVID pieces? I guess, you know, the more severe symptoms of it or anything, is there anything being strategized or even thought through at DOH around this?
Yeah, I mean, I guess there could well be. I'm not aware of anything. And again, I think it's sort of my area of COVID is still kind of the acute response or kind of my job within DOH. But I definitely think, to your point, it is something that, you know, the state and the healthcare system as a whole really needs to think about, because it is, you know, the numbers are shockingly high, how many people are suffering from post-COVID. And for some, you know, might be a visit or two, and mostly, you know, kind of figuring out at home or waiting it out. But for, you know, a lot of people do better with physical therapy or speech therapy. And I mean, I know from pre-COVID and just working in regular times how hard it was to get those resources for people, and how many people in the state live, you know, if you have to drive an hour to go for speech therapy, you're not going to go. And when you look, I mean, I think it was nice to see that for that website that's tracking these post-COVID centers, you know, it's nice that we do have some of our healthcare system paying special attention to that. But again, that's a very, you know, I mean, Loveless has a number of places, but, you know, we know that that's just kind of a drop in the bucket in our state. So I think it is something that really has to get planned for. And I think you're right. The healthcare system's just like, oh my gosh, we're all exhausted. We've been kind of going on acute COVID, and it is hard to shift gears, I think, or hard for people to shift gears and really start to do that long-term planning. And it would be nice to know a little bit, you know, I'm sure everyone's like, oh, if we just knew the answer, this would be easier, but I think that's going to be a while yet.
There was one other area I'm just, again, right now, I'm just kind of probably asking more for your opinion, or at least what you've seen in the field. But, you know, one of the things that we're hearing more about, and I don't think it's classified as like a symptom or anything of long-term COVID, but the aspect of so many people who are having a lot more trouble with mental health, behavioral health issues right now. And a lot of that just because not so much maybe being sick with the disease, but everything else, coming with it, like isolation, disruption in the school system and everything. And I just wondered what some of your thoughts were about how we might be thinking in the state about trying to address that, given that we don't have that many providers in that area.
Yeah, I think that is just another really tough question. And I think, it is going to take some creative thinking. I think I think we did develop some new tools during the pandemic, like community through, virtual community, the idea that you could have really, like the body politic runs an online support group, so it doesn't have to be in the state. It doesn't have to be in, we don't have to have a expert in Albuquerque, Santa Fe, Las Cruces, every place in the state. So I think trying to think about leveraging some of that. And then I think it doesn't all necessarily have to be, a psychiatrist or a psychologist. Some of it is just bringing people back to, share experience, to, I mean, sharing information, I think, is really powerful. If you have depression or anxiety, then information alone isn't going to fix it. But I think for a lot of people that are just, again, it's a real spectrum of behavioral health impacts from the pandemic. So I don't have a good answer, but I do think, I think some of the interventions you guys are doing, spreading information,
I don't think
making
anybody's
people,
got a good answer.
yeah. And then trying to figure out safe ways to be connected is important.
So Dr. Durham, at this time, I just want to thank you so much for providing this information to us tonight. It has been such a wonderful learning experience and a really great opportunity to talk and ask questions about this important topic. I do believe it's important to say, we have questions, we might not always have the answers, but this is what we're here for, to discuss and just have this open dialogue with everyone. So Dr. Durham, thank you so much.
Yes. Well, thanks for having me. It was a pleasure. Thank you for all the work that you do.
And in closing, I do want to say that we are continuing with the Salud Querencia community dialogues. And so again, my name is Diana Lopez, and I am a health promotion specialist with the Northwest Region team for the New Mexico Department of Health, and a proud partner with the Health Equity Council.
Thank you very much, Dr. Durham. We'll be seeing you again.
Definitely. Enrique, I saw you unmuted. Did you have a comment?
I just wanted to say thank you, Diana and Anna, for hosting us, Dr. Durham for presenting, and everybody that showed up.
Yes, wonderful. Thank you all, and wishing everyone a wonderful night and health and happiness, and be safe out there.